And now I'm seeing some stuff. And what I'm seeing, up, you okay? That was actually much more of a better response. What if I told you that you can actually improve balance and flexibility by these headphones that you can easily get from Target, Costco, anywhere you want? And these are called bone conduction headphones. Let's take a look. So these are called bone conduction headphones, and these are the Shocks Open Run Pro. So you can find these anywhere in Target and Costco and anywhere you want. And the funny thing is that the manufacturers for these headphones didn't realize how therapeutic these things are. So these are called bone conduction headphones because, as you can see, these headphones do not go inside the ear, but they're placed right beside it. And what these headphones do is they vibrate. So vibration stimulates the part in your skull called the vestibular system. The vestibular system is basically your balance system. It is your natural GPS system. It tells you two things. It tells your brain two things. It tells you which way is up. So it tells me that I'm upright, which tells you that people with scoliosis, they think that this is upright, so they kind of have a little bit of a messed up vestibular system. And the second part, it tells your brain is which way am I going, right? So it's your natural GPS system. So this is a phenomenal tool that you can use, very easy to use, to assess and fix your own balance. If you feel like you have loss of balance, or if you have a history of vertigo, or you just have this sense of unsteadiness, or if you notice some tightnesses, especially in your neck, that has a lot to do with rotations, extension, flexion. So you might notice that your neck feels better by using bone conduction headphones, and you might also notice a better sense of balance, that you feel more steady. So now the two things that you have to keep in mind here, you have to get the Shocks Open Run Pro. There's an Open Run Pro 2 now, which is just 30 bucks more expensive. It's the same thing. And you're gonna need to download an app on your app store. And this app is called Function Generator Pro. We're gonna be using this app to play around with some frequency sounds. We're gonna test out on my athletes, we're gonna check out some frequency sounds from 100 hertz to 200 hertz to 300 hertz, all the way to 500 hertz. And we have to see now, does she need to hear this on the right ear or the left ear or both? Because only one inner ear may need a little bit more stimulus than the other. So that's why we always test and retest. So let's go on and let's take a look at this. All right, guys, now let's take a look. Here with me, I have my iPad and I have the app Audio Function Generator Pro. And what you guys are gonna be looking at is a screen like this. So it's just a bunch of numbers on here. It's got a frequency at the very top. It's got some wiggly lines. I tend to pick out the second one that's like a little square shape. And I'm also looking at where it says BPM. BPM, which is beats per minute. I usually set it at the client's or the patient's resting heart rate. So if my client has a resting heart rate of 60, I have to make sure that I put 60 beats per minute. So this way my client can hear a sound that goes accordingly to their resting heart rate. So I have now 100 hertz, both ears working on headphones at 60 beats per minute, and the volume is loud but comfortable. And I start off by having the sound coming from the right and the left ear. So hopefully that makes sense. Let's call in Laura. So we have Laura again here. We're gonna check out three things with her. We're gonna check out a Romberg's test, which is a balance test. And then we're gonna check out her neck, because bone conduction headphones, you'll most likely see very immediate results at the neck, and then later on you might notice them at the lower back or even lower down the chain. We're gonna check out some balance. Now, I'm gonna tell Laura to have her feet together, narrow stance, and first we're gonna see what happens with her eyes just completely open, looking at the horizon. And I'm just looking at her from behind. I'm looking for any kind of swaying. So as I'm looking at her, pretty stable, very minimal. And now I'm gonna tell for Laura to close her eyes. Let's close eyes. And now I'm seeing some stuff. And what I'm seeing, up, okay? And what I'm seeing, as you guys may have seen also, is that she was falling to her left, right? Now, I want to confirm that by doing perturbations. Going to give her some pushes. Not going to smack her or anything like that. I just want to give her a little bit of a push just to see how fast does she return back to midline. So from here, stand right behind her. Whoop. Okay, when I hit her from the right side, I made her fall to the left. And notice how long it took for her to return back to the middle. As opposed to her left, I pushed her and she was very, very quick to return back to midline. What that tells me is when I smack her to the right side and she easily falls to her left, it's probably her left inner ear that is not functioning well. Because the left inner ear, the left vestibular system, is responsible for the ipsilateral, same side, anti-gravity muscles, her erectors, her hamstring, her calf. If that left vestibular system does not work well, all these posterior chain muscles, they're not working at maximum capacity. So that is one thing that I'm seeing now with this Romberg's test. Now let's take a look at her cervical spine range of motion. All right, now let's take at her cervical spine range of motion, her neck. We're gonna mainly test, let's check side bending. So let's go to the right. Okay, that's to the left. Still right side tighter. Yeah. Let's check head rotations. That's to the right. And more limited going to your left. Okay. So now let's also check flexion extension. Let's face this way. And let's see flexion. Okay, and let's see your extension. Which one felt tighter? Extension? Felt like a tugging in the front of the neck? Okay. Now, meanwhile, just to make sure that you know this, guys, she has the bone conduction headphones on her ears, but they're not playing. There's no sound on it, nothing yet. We just have them hooked on there for now. So this was just a general little range of motion test. You saw her restrictions as well as her Romberg's testing, her balance test. Now, let's see what happens with her neck, starting with that, by using bone conduction headphones. In the app, I have 100 hertz of frequency. I have the square-shaped line pressed. Both her ears are going to be working. And I have the BPMs at 60 because she has a resting heart rate of 60. It's probably less than that because she's an elite athlete, but I'm going to keep it to 60. So now, tell me if you hear a sound. Okay. All she hears now is a beep, 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 right? So 100 hertz. Let's recheck the neck again. Okay. Any difference there?
No.
No? No. Let's face sideways. Let's just see your extension and flexion. Flexion's the same. Still kind of tugging there on the neck?
Yeah.
Okay. So 100 hertz didn't work. Let's try now 200. So I'm going to up the frequency to 200 hertz. Again, I'm going from 100, 200, 300, 400, 500. So now we have it at 200 hertz. Both ears working. You hear that? Let's see again. Side bending.
A little better.
A little bit, right? And check your flexion extension. Right. Yeah, here. Yeah, not a big change. Now let's put 300. Let's see what happens. And that is 300. Let's check that now. A little bit. Let's see. Yep. Flexion. That went a little bit lower.
Oh, that's much better.
That's much better.
Yeah.
Okay. So 300 so far. Let's try 400, see what happens. And let's give it a go. Yeah, that looks a little tighter. So 300 is sweet spot. So we are at 300. And now I'm going to test out 300 again, only left ear. Give that a go now. How was that?
So everything feels smoother?
Smoother, all
Smoother.
right? Flexion got a little bit more. Just for shits and giggles, let's also put right here, see what that does. Tighter. Ooh, nope. Nope. The extension is gonna be shitty, let's see. And that's a no.
Yeah.
So she needs it on her left ear so far at 300. Now let's check out her balance. All right, so now we're gonna check again her balance. We're gonna do the Romberg's test. I have the app shut off for now. I kept it at 300 hertz on her left ear, 60 beats per minute. So far, that showed me the best. I'm not pressing play again. I'm just gonna retest again with no headphone stimulation. Let's just see first what that did. And eyes closed. And not as bad. Still some shifting to her left. Keep the eyes closed. We're going to do some perturbations just to confirm it now. Ready? Here we go. Whoop. And that was still not that good on her left side. Let's press play on this app. So now she can hear a 300 hertz frequency sound on her left ear, 60 beats per minute. And yeah, she's just listening to that sound at a very comfortable volume. Now, let's see what that did. First, eyes closed, no perturbations yet. Just looking at your posture. And that to me looks a little bit more centered. All right, and now let's check those perturbations. Eyes are closed, here we go. Ready? Oh. Up, a little bit to the right, but it's okay. But to that left, that was actually much more of a better response, right? Did that feel better?
Yeah.
Right? So that's how you can start fixing your balance by the use of bone conduction headphones, right? This way you don't have to do a lot of vestibular drills that some vestibular therapists give you, which they're great, but I can have headphones on there so it can do the job for me and allow me to do other things in the mix. So this is the power of bone conduction headphones. For some people that have bad balance issues, vertigo, this thing is a wonder. And if you have, like, let's say a poor connection with one side of your body, you don't feel your left hamstring, you don't feel your left bicep, maybe the vestibular system is one thing at fault here. So definitely try these bone conduction headphones. You can find them off at Target, Costco. Download the app, and you just have to play around with your frequency sounds, which ear you have to hear it, and then you just constantly have to retest yourself to see if you feel more stable. So hopefully this was very useful for you guys. Thank you all very much for watching. You guys are going to be able to see this also in my new Move mentorship program that I go into great detail about the vestibular system and the visual system and all kinds of systems of the body. So if you haven't really registered or signed up yet, follow the link below to check out my new Move mentorship program. So this way we can get started, and I'll see you guys there. Here's an offer for you that you really don't want to miss. I'm offering a 1-month pass for my new Move mentorship program, 1-month free trial for the amount of $50, which is actually refundable if you find the material in my mentorship program not really relatable to what you're trying to achieve. So I'm offering for $50 access to my new Move mentorship program to the first 2 modules in which you're going to learn about functions of the brain, neuroplasticity, neurology, and breathing, as well as proprioceptive and motor control systems such as mobility. Check this out. It's only $50 to apply. Apply right now for a limited time. You have a 1-month access, and you also get 1 coaching call with me at any time within this month to talk about any of your clients or any of your cases, or even about yourself if you're suffering from any injuries, or if you want to ask more about the mentorship program. So sign up now for this limited time deal for $50 to get 1-month access for the first 2 modules, and plus any more other benefits that I have for you. Sign up now at the link below, and I'll see you guys there.